Hi, myself Dr. S. Mohammad Akram Ali, PharmD, Assistant Professor, Department of Pharmacy Practice, Sri Sharma College of Pharmacy. So today we're going to see about introduction of glaucoma. So first of all, what is glaucoma? A collection of eye disorders known as glaucoma. It can cause damage to the optic nerve, which is essential for clear vision since it transmitted visual information from eye to brain. Elevate intraocular pressure is frequently associated with optic nerve damage. So, however, normal eye pressure does not guarantee the development of glaucoma, a group of eye disorder that can cause vision loss and blindness by damaging a nerve in the back of your eye called optic nerve. Normal eye pressure is usually considered to be between 10 and 20 mmHg, millimeters of mercury. A group of disorders characterized by progressive optic neuropathy, characteristic appearance of the optic disc, specific pattern of irreversible visual field defects associated frequently but not invariable with intraocular pressure. So usually the glaucoma means it's an eye disorder that affects your optic nerve by increasing intraocular pressure. So once the intraocular pressure increases in the eye, it affects the nerve called optic nerve, which transmit the vision. So if that affect means that make the patient visual defect. So in the image we can see the normal eye and the glaucoma eye. So in normal eye the pressure is normal, while in glaucoma eye the pressure is increased. So through this increased pressure it can pressurize the backside nerve called optic nerve, which transmit the vision from eye to the brain. So it affects the optic nerve and makes the patient blind. So this is the introduction of glaucoma. Then types: open angle glaucoma. So this type of glaucoma is the most prevalent. The iris and cornea continues to form an open drainage angle, so that's why it's called as an open angle glaucoma. However, the drainage system, other components does not drain correctly. This could cause the ocular pressure to rise gradually and slowly. So these are the open angle glaucoma. Then its signs and symptoms. So signs and symptoms of open angle glaucoma. First, in early stage, it is asymptomatic. Asymptomatic means no symptoms, but in later stages, it seems difficulty in seeing things in your central vision. Then gradually, patchy blind spots in your side vision. Side vision, also known as peripheral vision. So in the early stages, the open angle glaucoma shows no symptoms, but in later it can affect your eyesight, gradually patchy blind spots in your side vision. So these are the signs and symptoms of open angle glaucoma. Then second type was angle closure glaucoma. So the iris enlarges and causes this type of glaucoma. The drainage angle is partially or totally blocked by the protruding iris. So pressure rises as the result of the eye inability to circulate proper fluids. Angle closure glaucoma can develop gradually or unexpectedly. So this is the angle closure glaucoma. So its signs and symptoms. The signs and symptoms of angle closure glaucoma is eye redness, blurred vision, severe headache, severe eye pain, then halos or colored ring around lights while seeing, then nausea or vomiting. So these are the signs and symptoms of angle closure glaucoma. Then normal tension glaucoma, when the eye pressure is normal, the precise primary cause of the optic nerve damage is unknown. So here the optic nerve causes of optic nerve damage is unknown in this type of glaucoma, this normal tension glaucoma. The optic nerve may feel less blood flow or become more sensitive. Then fat deposition accumulating in the arteries or other disorders harming circulation could be the reason of this restricted blood flow. The term atherosclerosis also refer to the accumulation of fat in the arteries. So in this type of glaucoma, the reason of optic nerve damage is unknown, but it can defined as that fatty accumulation, which means atherosclerosis may leads to the restricted blood flow. By that, the pressure can increase and affect your optic nerve. So this is the third type of glaucoma, normal tension glaucoma. Then etiology. So etiology of glaucoma. Etiology means causes. The causes of glaucoma or optic nerve damage, a chronic or progressive eye condition that results in loss of visual field, eye pressure. I mean increased eye pressure. In that image, you can see the dilated eye drops, restricted drainage in your eye, then medications such as corticosteroids, then reduced to blood flow to optic nerve, higher elevated blood pressure. So these are the causes which can affect, which can induce glaucoma. Then there are some other etiological factors that are dilating eye drops and certain medications may trigger an acute glaucoma attack, which means sudden attack of glaucoma, such as trimethoprim. Sulfamethox is also antibiotic, which can also cause the glaucoma. Then acetazolamide, then hydrochlorothiazides. So these are some type of medication that can easily triggers the glaucoma. Then the loss of retinal ganglion cells is linked to intraocular pressure. Then fluid accumulation due to an anomaly in the drainage system of the eye can result in high pressure, which harms the optic nerve. So these are the etiological factors that causes glaucoma. So thank you. So in this video we see the just introduction of glaucoma, that is what is glaucoma, then its types and its causes. In the next video we can see the diagnosis and pathophysiology, then management of glaucoma. Thank you.